you're low in vitamin D or zinc or copper, your joints aren't going to heal either. So, there's so much that goes into this.
Yeah.
That, all of us need to be looking kind of whole person, even if it's just knee pain. Hey,
Hi.
sorry, I was not coming up with any kind of connection.
Oh, that's okay. It happens. And I just fill the time with mindless blabble.
Good job.
Everyone in this audience, we have really just the best audience. Everyone is so kind and so excited about learning, learning and knowing more and learning the tools. And before you got a chance to jump on, I had the opportunity to give everyone a little bit about your background and why
Great.
this is going to be such a fun conversation, because we're finally focusing on something that isn't a topic that is talked about enough. Just talking about our joints and arthritis and inflammation of those parts of our body, which often goes overlooked for some bizarre reason. And you really brought that to my attention when we talked, and thought, that's so true. We just sort of assume that as we age, we'll have joint pain. I mean, I don't, but
Right.
As a society, we kind of make that, we have that misconception that this is just the natural course of aging and just the baseline that you'll eventuate to. So I'm so excited that you're here to shine a different light on it and all the different things that we can do. And there's a bunch of people that have jumped on, a few hundred people have jumped on after I gave a brief intro of you. So if you wouldn't mind just sharing with everyone here a little bit about your background and your passion for this. And I did let them know that you also do functional medicine, which is so cool. So that'd be great if you could just share with everyone.
Yeah, I'd love to. And thank you, Serena. Thank you very much for having me, because I actually, I love to do this. I love to share this information. And I think there's a big, as you and I talked about, there's sort of a big lack in thinking about our joints and our spines in this kind of functional longevity world, right? Everybody starts thinking about the brain and the heart. And so we're trying to bring this into the light of this is also a disease. Right. So my background is I've spent 30 years in orthopedics. About 18 years ago, I started to get a little frustrated because people would come in and we, kind of make them a little better, stick steroids in a joint, do surgery, whatever it would be. And, and then they'd go on their way, but nothing would ever really be healed. It would sort of be like, maybe I'm better. And then they come back a year later and another joint would be bad. And, so it was always felt like I was sort of just patching them up and then bringing them back and patching them up. So I started to kind of explore, could we actually make people healthier and better? And that sort of started me down the road 18, 20 years ago when this field was pretty much in its infancy.
Yeah.
This whole regenerative world or functional medicine world. How do we get people healthier and see if that would help them heal? Mm-hmm. So went back and did fellowship, in anti-aging, regenerative longevity medicine. And I incorporated that into my orthopedic practice a little bit, but it didn't work all that well because, as you know, in your world, you have to talk to people and teach people, and it takes time. And in those 10, 15-minute appointments with orthopedics, you really couldn't talk about your health. You could say, okay, well, we could stick some steroid in your knee. But you couldn't really talk about how you could actually make people healthy, right. And which is actually, getting their nutrition in order, getting their hormones in order, and then, working from there. So I opened about 17 years ago, Boulder Longevity Institute, which is more of a functional medicine oriented clinic. And I actually did both practices. So I would do one by day, one by night, just change my hat. And then I got increasingly sort of frustrated with feeling like I was actually not really making anybody better. And I left orthopedics and came over here. And we still do orthopedics here at Boulder Longevity Institute. We just do it in a much more functional and regenerative capacity. So we do a lot of regenerative orthopedics, stem cells, things like that. But we work much more diligently on making people healthy. So that's where my kind of background comes from, and where we're going to be looking at this whole process that, of back and joint pain, which have kind of been thought of as a wear and tear phenomena, as a disease process.
Yeah, and let's kind of dive into that a little bit, because I think that is really, if you would ask anyone off the street what that is, what arthritis is, what they can imagine themselves to be when they're 80 after they have been playing sports for, like 30 years, or just, what is that I want to say misconception that people have. Let's really address that, because I think that people are just so used to it. It's just, they just accept it,
You're right. We
they don't
have
think
to
twice
start
about
changing
it.
that paradigm.
Mm-hmm.
So, first of all, it's understanding that when you've had David on you and David get together a lot and talk about longevity and aging as a disease, right?
Mm-hmm.
And so we're starting to understand that aging is a disease.
Mm-hmm.
And so people now are, when we look at dementia and we look at cardiovascular disease and all of these processes, we're understanding these are diseases that are, that aging is just a part of this whole spectrum.
Mm-hmm.
But somehow joints got left out of that.
Mm-hmm.
So still, when you have a knee that hurts you, people go, oh, well, you played football, you wore your knee joint out. But somehow we've accepted that paradigm in joints, that you used it too much and it wore out, much like the tread on your tire.
Mm-hmm.
And that's not true. So this process starts very early, right? From little injuries from a young age, just like aging starts very early.
Mm-hmm.
So the earlier you can start thinking about this and intervening, the better off we are. So what we have to sort of understand is that when and orthopedics is not, if you think 30 years, the practice of orthopedics hasn't changed. If you go into your doctor with your knee hurting, x-ray it, put you in some physical therapy, put you on some meds, that doesn't work, stick some steroids in it, that doesn't work, do surgery, that doesn't work, replace it. And that's all we've done for a number of years. So that's because every orthopedic doctor will tell you wore out your joint. You're too fat, you exercised too much, you ran too much, whatever it might be. You just wore out your joint. Right. So what I really want all your listeners to start changing their understanding of is that you don't just wear out joints.
Right.
So what happens, much like all those other diseases we talked about, is that we all have these little injuries, sometimes big injuries, sometimes little injuries. And the response to an injury is inflammation.
Right.
So we bring in all these inflammatory proteins, these cytokines, and they're designed to bring in a little inflammation and then go away. And then the anti-inflammatory cytokines come into play and healing occurs. So why doesn't that happen? Well, if you get stuck in that pro-inflammatory phase, all these pro-inflammatory proteins stay around and the anti-inflammatory proteins don't come around, then you start progressive destruction. So if you have perfect genetics and perfect nutrition and you're sleeping and then your immune system is going to be better, but very few of us have perfect immune systems.
Right.
Which is why most people with injuries go on to develop arthritis, is because your immune systems aren't perfect, and they get worse as we age, right?
And it's layering, right? It's layering,
right? It's layering.
Usually when with those lifestyles, unless you have all the things to kind of support, mitigate, balance out what happens to the cells, what happens to the body, then things start to stack over time, but it gets this label as arthritis,
right?
So it just sounds like what you're saying is, listen, just like every other part of our body, we can address this preventatively. Like, we can look at it, if we're looking at arthritis as like heart disease, we're looking at arthritis like it's Alzheimer, and we have this awareness now and all this knowledge and education, all these different regenerative therapies and supplements and so many things, and just diet and lifestyle, so many things that we can actually do to help support ourselves in other focuses. We can do the same with arthritis.
Right. I mean, it's exactly so what, and I love, because I think you have a lot, if you're young, you have maybe a younger population who listens to you a lot too. One of the problems is lots of times we don't start thinking about things until we're, my age, until you're older. And, one of the messages we really are trying to get across to people is that we need to start addressing these diseases before they progress, right? Yeah. So if we could if you look at, for instance, I tore my first anterior cruciate ligament in my knee when I was 16, tore another one when I was 18, tore another one, I had 4 ACL reconstructions. Wow. And then tore them again. And now I have pretty bad arthritis in my knees, right? Well, if I'd known then what I know now, then it may not happen. So what we are trying to do is, when you have these injuries, even at a young age, is make sure that people have an appropriate response. So 80% of people who tear an anterior cruciate ligament go on to develop arthritis by the time they're 50. They have significant arthritis, 80%. So most people had a bad immune response. Even if you fixed the ligament, they go on to develop arthritis. So what was going on? It created an immune response.
Right.
And that immune response propagated, did not heal appropriately. And the arthritis started at 16, 18.
Yeah.
You don't make those until you're 50. So if we can now say, okay, if I take that person who has an ACL tear and I put them on something to help an appropriate immune response, then can I prevent their arthritis? Yeah. So that would be our goal, right? Can we prevent this from ever starting?
Yeah.
Now, not to say, even if you're my age and you have arthritis, can we stop the pain? Can we stop the progression? Yes. It's harder to reverse damage done than it is to prevent damage, just like heart disease or brain disease or anything else, as you know, right?
Just like anything, you know, it's always easier to prevent something than it is to fix something after it's gone in a direction that we don't want it to go to.
Exactly.
But this is why I love what you're talking about, what you're sharing, and I think that the audience here is, an audience hungry for that kind of information, because they're here to learn about different ways that we can support our bodies, our longevity, our immune systems, and through different ways. You know, obviously we talk a lot about nutrition here, just via my platform, and we talk a lot about supplements, and then different modalities too, everything from stem cells to meditation. There's so many different ways. So I would love if you could share some of the tools that you use in your clinic with your patients that you've found success with, just to give people some insight into what they can start to look into in their own, in their own hometowns and community, what they can start to really educate themselves on and consider for themselves.
So the first thing you gotta do is say, what am I treating? So number one, what we know goes wrong is that we have very high levels of these inflammatory molecules, cytokines, particularly something called interleukin-1 beta, tumor necrosis factor alpha, interleukin-6, super elevated.
Yeah.
So I've got to bring those down. I have to block those pro-inflammatory cytokines so I can bring up the anti-inflammatory cytokines. So that's number one. So there's a few ways of doing that. We'll talk about here in a second. Number two, when you have these high levels of inflammatory cytokines, the next thing that happens is the cells start to suffer damage, particularly the mitochondria. Remember, the mitochondria are the energy powerhouses of the cells.
Yeah.
So once the mitochondria are damaged, and we have these injured mitochondria, they actually start producing a lot of reactive oxygen species, a lot of damaging proteins. Those cells are designed, those mitochondria and cells are designed, when they get sick like that, to kill themselves. That's called autophagy, right? Yeah. Or mitophagy if the mitochondria kills itself. And then we recycle the good parts and we keep the good parts and we get rid of the bad parts. If the cell doesn't kill itself, then it stays around. We like to call those zombie cells in my world, because the zombies, these big nasty cells, are spewing out proteins, right? And those are senescent cells, right? Zombies. And they are zombie cells. They're cells that should be dead. They're not. And they start killing the cells around them. So let's say you have an injury, right, to a cartilage cell. And now I have these high inflammatory proteins. That cartilage cell's injured and it doesn't kill itself off. It doesn't practice normal autophagy. Right. It damages another cartilage cell. And that's why these little injuries go to rapidly progressive destruction of the cartilage. And now you have a bone on bone knee joint. So you've got to block the cytokines. Then you've got to encourage the bad cells to go away. So we have to encourage autophagy. Right. Study came out in 2020, completely ignored that autophagy may be one of the big links to osteoarthritis and degenerative disc disease. That altered autophagy is maybe the first step in progressing things down that road. So, and no attention paid to that. Instead, we just wait and we replace the knee. So we've got to get rid of the proteins, get the autophagy back, and then you can do regenerative procedures. One of the things you've seen all these regenerative clinics pop up, right? They're sticking stem cells in the knee. Well, if I stick stem cells into your knee, but you still have these very high levels of inflammatory cytokines, and a lot of damage, then I'm probably not going to make as much headway, right? Than if I fix you first and then do that.
Yeah. So let's share with people, what's your process and the things that people can do when they see a practitioner like you, but they can also do on their own.
Right. And so because there's some very simple things, because there's some supplements that, we use some medications for that, but there's simple supplements. So one of the things that we use a lot are what are called epigallocatechins or EGCG. That's what's in green tea, right? Well, that's a really, Yep. I mean, and you have to take a little high dose, but so we use EGCG, and you can take a couple of those twice a day. That starts bringing down some of those pro-inflammatory cytokines.
Mm-hmm.
The next thing we do is you've got to encourage autophagy. So what encourages autophagy? There's a few supplements that do. Well, fasting does that, right? So intermittent fasting or time-restricted eating helps encourage autophagy.
Yes.
But one of the supplements we love is spermidine, and that's you mentioned it.
Yeah.
Spermidine is what's called a polyamine, and it's naturally found in our gut. We know that people who have higher levels of polyamines in their diet, like Mediterranean diets, things like that, have longer lives, they have better brains.
Yep.
But so these polyamines, there's three of them, the spermidine, spermine, and putrescine. But spermidine is the one we kind of are targeting here because it seems to have the most value. You can get it from some foods. You can get it from things like fermented foods, stinky cheeses.
Cauliflower, broccoli, chickpeas, mushrooms. I mean, it's what's nice is that spermidine, it can be found in foods that we can actually ingest through our gut, and so
it's a really natural compound, right? Yeah. You can't actually take too much of it.
Right.
You can, more is really better, right? Yeah, I mean, more is better. Mm-hmm. And so what we'll always do, and so any of you guys who have an injury, first thing you do, you get on epigallocatechins, you get on spermidine, because now what have I done? I stopped that bad inflammatory cytokines. Now I encourage the damaged cells to go away, and now I'm not going to progress to the arthritic state. So you start using the spermidine. Spermidine is an autophagy-inducing agent. So basically, it's telling these bad cells to die. So we get rid of the zombies. It's our zombie-fighting agent.
Yeah.
And again,
would you mind diving a little bit into the nerdy stuff, because we love that and I love that, just about how this molecule, which is this, it's present in plants, it's present in animals, it's pretty much in every cell of our body. We make it, we have it. How does it do that? Because not all molecules do. So if you could explain that a little bit.
So, there's actually a fairly extensive kind of pathways there that it's working on, but it's one of the few agents that actually can work at the mitochondrial level. Right. So, it's actually at the mitochondria that it's very few things that supplements you take, things like that, can actually work at the mitochondria. Most of them can't get into the mitochondrial cell membrane, but spermidine actually works on the mitochondria. Remember, that's where this process is going awry, this oxidative phosphorylation, this ATP production. And when that oxidative phosphorylation, ATP production goes awry, that's when the reactive toxicity. So it's working at that level to get rid of the damaged mitochondria. And there's a lot of different pathways involved there, but I think the main thing you need to understand is it's one of the things that can actually work on the mitochondria to cause basically this autophagy, to cause them bad mitochondria to go away and encourage healthy mitochondria to survive. Yeah. So we're actually kind of doing two things, helping the good mitochondria, getting rid of the bad mitochondria. But also it has really good benefits as an anti-inflammatory agent in and of itself. Very much so, when we talked about those interleukins, a study that was done 2021, so just last year, showed that it actually was a really good agent at blocking some of the bad pro-inflammatory cytokines like interleukin-6 and upregulating some of the good ones. So, which may be why it's so, prominent in helping every disease process, right? We honestly think mitochondrial dysfunction, altered autophagy, high levels of inflammation are linked to brain disease, cardiovascular disease.
Every disease.
It's probably the hardest sell about spermidine to me is, it's kind of like when you're trying to sell snake oil or something, it's too good to be true, where people are like, well, you can use it for your brain, you can use it for your heart, you can use it then people get suspicious of it. Yeah. But it's because every one of those diseases is really linked to the same problem, which is damaged mitochondria, altered autophagy, and subsequently progressive dysfunction. So,
I agree with you. It almost sounds like it's too good to be true.
Right.
But I'm so grateful that you really kind of broke it down, because, and I'm not sure if you were on when I was introducing you earlier, but I let everyone know that you actually serve as an advisor on their scientific board. So you're well versed in the science and really understanding how this molecule works. But that
it's kind of funny, We actually, so I'm in this kind of big cellular medicine mastermind group, and we
Yeah.
actually started talking about spermidine as
Mm-hmm.
potentially this just amazing agent for anti-aging, probably, I don't know, 6 or 7 years ago, but you could not get it in the U.S.
Right.
It was in Austria, it was not
Right.
available in the U.S. And literally, so honestly, I kept calling the company
Mm-hmm.
and saying, hey, I really want to get this, couldn't get it. And then oddly, finally one day, and I was persistent, I kept calling. Finally one day, like, hey, actually we are
Wait,
coming to the
did
US.
you bring them here? Do we have you to thank for bringing this
Yeah.
product here? Oh
I
my
think it might have been
gosh.
coincidental, but
Okay, so you guys, I know a bunch of you have asked what brand. This is the brand. It's called Spermidine Life. It's what I use. It's what we're talking about here. But I mean, you're one of the, you're like on frontier. You're calling.
yeah, I mean, I really was funny because I finally, and I'm in Boulder, Colorado, and they actually moved one of their centers to Denver, Colorado. I was like, oh my God, you're going to be right here in my backyard. And we just got so excited.
Oh, wow.
But when you look at one of the things, when you look at somebody who's coming in with an injury, or let's say you're sick, I mean, same thing. So it's kind of a maintenance dose of spermidine. When you look at that bottle that you have,
Right.
it's 2 caps, which is about 1 microgram.
Right. Slightly over,
But
yeah.
I honestly have to tell you that when you're looking at trying to actually get somebody to really, heal, you oftentimes have to go much higher than that.
Oh, yes, of course.
I mean, so we'll usually put people sometimes on 6, 12 micrograms. So we'll put them on relatively high dose when they've had an injury, or when we're trying to get them ready to do a regenerative procedure. We'll hit them pretty hard. Like I said, it's almost, I think it's probably impossible to take too much.
Yeah.
Aside from it costs a lot of money. But
Wow.
other than that,
that's actually really good to know. It's because there have been questions that have come in about that, about dosing. I take more than the 2 caps myself. So it's great to know that you can't really overdo it. And I see a lot of questions here about the product and what we're talking about, more information. Just real quick, if you go to the pinned comment here, you can see Dr. Yurth's Instagram account. I would say go there, follow her. She's a wealth of information, especially on this topic and so much more. And then you can also ask her directly, and she's got just talks and speeches and papers and everything. So go check that out. And for those of you that are looking for the product, if you go to the link in my bio under the Longevity Lifestyle series, we have a link to them. And so it makes it easier. You can if you type in spermidine, a bunch of things might pop up, but the one that we're talking about is Spermidine Life, and you'll find it there. So just to make it easier for you guys. But I highly recommend you go and you follow Dr. Yurth, because you'll learn so much more than you're learning even right now in this live.
And Serena, I say one of the questions that came up here is this just preventative rather than after the fact? And I'm going to answer that question because I think that's important, because the answer is no. In fact, there was a great study that was done out of, I think it was Sweden, maybe Austria, where they actually looked at people, at really damaged cartilage. It was not in mice, but looked at very damaged cartilage, and they put them on spermidine, because spermidine blocked the oxidative, that overreactive oxidative phosphorylation pathway, blocked the oxidative stress. It halted the progression of the arthritis. So it actually stopped it from progressing from square one, where it was. But when they watched them over time, they actually saw improvement in the cartilage cell. So, one of the things you have to remember is that our bodies are kind of designed, if you do everything right, to heal.
We are.
If we can stop the process that's causing the progressive damage, then you can do things, that you'll heal on your own. Now, if you have severe end-stage arthritis in your joint, are you going to get back to a normal joint? Probably not. But can you then set the stage to do things like stem cells, things like that then may be able to really take you back another notch, right? So I think always prevention is great. Right. So if so just, those of you who have kids or, are young yourselves and you have an injury, how easy to take some spermidine, take some epigallocatechins, and sort of keep that from progressing. But for those like me who didn't get started on this till late, I will tell you that, that I have pretty much end stage arthritis in my knees, but I'm very active. I, work out a lot and my knees don't hurt. So I've stopped that inflammatory process,
That's amazing. And how long, do you mind me asking you, and please don't feel like you need to answer, just, if you were at sort of an end stage, how long did it take you to get to this point where you can be active without pain?
Well, and I think you have to kind of go high dose. Sometimes, you have to throw other things in there too. Like we love a medication called penicillin polysulfate, which is approved by the country. We love that for arthritis as well. Sometimes you have to, if you have end stage arthritis, you're gonna have to hit this from multiple different pathways.
Right.
So if you're just doing spermidine alone, or you can get there, probably have to hit multiple different places. I think it's a part of the story and not the whole thing. If you're at end stage arthritis, there's other things you need to kick in. But
I think you're just a beacon of hope, because there are so many people that have reached that point, and even before that point, that think that they don't have any options. And here,
right.
Today you've given us so many options, so much hope, and just not even beyond hope, you've just given the steps. This is how you do, this is what you do. And ideally, you're doing it preventatively, as you would do anything else, in your efforts to extend your longevity, extend your lifespan, maintain your immune health. You need to focus on that as well, the inflammatory response to your system and how it affects your joints.
Right. And that's where so if I'm going to block all the bad stuff, how do I get the good stuff to come in? That's where, your piece, nutrition, sleep, all those things. That way I get myself into an anti-inflammatory mode that allows me to heal, So blocking all the bad stuff allows the good stuff to come into play if you give your body the things you need. I mean, hormones play a role here too. You have to say that when you're, remember, hormones have a big play in joint pain too. And so when you look at things like if you're my age, you're 6 years old and you have, if you're not on any hormones, it's a little hard to build muscle. It's a little hard to have low inflammation if you have no progesterone, if you have no estrogen. So there's a lot of things that come into play, but if you fix the body, you use things like these supplements like spermidine, like epigallocatechins, things like that, and get yourself into a really low inflammatory state, you will heal without having to go replace joints. Now, some of you who are already, at end stage arthritis, and you're like, do I think there's sometimes a need for joint replacements? Yeah, I mean, you do, but people think the end all cure all is going to be the replacement of the joint. Remember, if you don't address the fact that all this stuff that got you there in the first place is still going on, and then your next hip goes, and then your knee goes, and your shoulder goes, right? So you still, even if you're at the stage where you need a replacement of a joint, you're going to have to address this inflammation. It's why people who have bad osteoarthritis have more cardiovascular disease.
Yeah.
That's because those same inflammatory proteins are doing those same things to your heart, right?
Yeah. You really have to have a foundation. And that's why I love and have so much respect for your approach, because it's really about giving people that base foundation. And that is what takes, that's what's sustainable too. I mean, just going in and getting the treatments, but not having that foundation really well built and not addressing how it all began, you're just going to end up in those type of treatments forever.
Right.
And it may not even prevent if that's the case. And that's basically what you do in Boulder, right, at your institute, is that maybe you can just sort of dive into what you guys do at the institute there.
Yeah, so we actually sort of look at whole body health. I mean, all patients who come in just to see me for their joint, and it's always a little of a struggle, right? They just are coming in from their knee arthritis, because it's very hard not to say, okay, yes, I can do things like spermidine and we can do stem cells and things like that into your knee, but underlying all of this, we need to look at all of your nutrients. We need to look at all of your hormones. We need to look at your cardiovascular markers and make sure that your cardiometabolic status is up to par. So what we really like to do is this sort of foundational health program where we run an entire cardiometabolic profile. We make sure that people have very low, nice, the correct insulin levels, that they don't have any inflammatory markers, that their cardiovascular, markers are all good, that uric acid's not high. And then we look at all their hormones. We make sure that they're all optimized, and not only optimized, but going down really safe pathways, which you can do with looking at urine metabolites. And then we can look at a full intracellular micronutrient panel, because if you're low in vitamin D or zinc or copper, your joints aren't going to heal either. So, there's so much that goes into this. That, all of us need to be looking kind of whole person, even if it's just knee pain.
Yeah.
But sometimes it's hard to convince people of that, right? You come in for knee pain.
I completely understand. I mean, the way my practice is very much the same. It's a very whole body holistic approach. And I add the energy aspect to it as well. So from lab work to Reiki, I look at every body and every level. And so sometimes it is challenging for people to really understand that everything is interconnected and address all of it and build a really solid foundation.
Right.
but I just love what you're doing, and I'm so grateful that you were able to take time to come on and explain it all, because I think it really gives people a different perspective. And we all have people in our lives that may have those challenges with arthritis or joint pain. And it's just giving them the information and the awareness that there's not only is there therapies and results that they can have, but there's steps to it, and they can start small, as you do. Start with some of these supplements, start with some of these therapies, get your foundation cleaned up, and then there are these options, which I don't think enough people know about.
Yeah. And again, you guys out there who are, and I love people like you who are spreading this word, because, I can tell you, your orthopedic physician is not going to look at your knee and tell you need to fix your hormones. So you guys have to understand that and be aware of it and educate other people. It's kind of what, our goal. We have a whole academy, we centered around so if you go to BLI.academy, that we do trying to teach you guys to become the educators out there, because the physicians, as you know, Serena, the physicians aren't doing it, right?
Well, and quite honestly, we're empowered to heal ourselves. So,
right.
If you've tuned in here, then you know that there are questions that you never need to ask that you now know to ask your physician. What are these other options I heard about here? What about this? What about, and I think that that's sort of the first step, is just giving people that knowledge, giving them the tools so they know what to ask, they know what to look for, instead of just kind of going into a doctor, a bit blindly sometimes. And so, again, I just want to acknowledge you for the education that you're putting out there, so that people now have an awareness. And it's amazing that you have an academy at your institute to further educate people. It's just awesome. So I want to thank you again, and you guys have been amazing today. Just so many really kind and beautiful comments, and I love that you guys love all of this. Definitely go to the pinned comment and give Dr. Yurth's account a follow. And she actually has a separate account for her institute. That's Boulder Longevity Institute. You might have seen it pop up here, but I'm sure the link is in your Instagram account, right?
Probably, yes.
Okay. It probably is. If it's not, look it up. Boulder Institute. Boulder Longevity Institute. And again, for those of you that are asking about spermidine, this again is the one that I use. And Dr. Yurth is, she prescribes on different levels depending on.
Yeah, and there is, there is sort of a prescription dose sometimes we'll use for those, but that has to be provided through a doctor. So these higher doses, have to be prescribed through a doctor, but we do have access to higher dose. It's like something called Longevity Labs, and it's one of the most, I think, one of the most pure products out there, which is why we use it.
That's really good to know, because we really are, you're such an expert here, and I'm so happy that we were able to chat about this. It's been so great, and I mean, you can tell from the feedback. You look at all the hearts and the likes and all these emojis. You guys are amazing. Obviously, everyone loves you, as do I. So thank you so much for today, and I look forward to staying in touch. There's a lot that we can talk about. So
thank you, Serena. I really appreciate you taking the time, and all your audience. Thank you, guys.
Of course. It was amazing. All right. Thank you guys so
much.
Bye, guys.
Thank you.
Have a beautiful day.
Bye.
Bye.